I'm a psychiatrist by profession, but I'm also a certified psychotherapist. A psychiatrist is, of course, a medical doctor. We are different from our basic training, different from a clinical psychologist who has a basic degree in psychology first, and a counselor who can have a basic degree in psychology but needs a master's degree in counseling. So we specialize in a particular area, and this is the area we call psychiatry. Actually, in our training as psychiatrists, we are also trained to do therapy. So we are trained to do individual psychotherapy, we are trained to do couples and family therapy and group therapy. A psychiatrist makes a diagnosis by assessing the patient, and we work towards treatment based on the diagnosis. Many people think we psychiatrists only prescribe medication. Medication is part of what we do. We are supposed also to offer support, and we are supposed to also offer psychotherapy if we are psychotherapists. And when medication and psychotherapy go hand in hand, we get the best outcomes in terms of treatment. But there are certain disorders or illnesses where the psychiatrist has to play the key role. For instance, psychotic illnesses like schizophrenia. The psychiatrist plays the main role, while the counselor and the clinical psychologist helps out in providing the support and therapy if required. So counseling has such a big role to play when we deal with our patients who are called psychiatric patients. So I would rather not use the word psychiatric patients because there's a lot of stigma attached to the term psychiatry. And that's one of the challenges we have. Then people with severe depression, depressive disorders, people with severe mood disorders like bipolar disorders, people with severe anxiety, people with substance use disorders, better to see the psychiatrist first before going on for more help from a clinical psychologist. I also believe that to be a psychiatrist or a clinical psychologist or a counselor, it's a calling to serve people who actually need us to journey with them. Just as each and every one of us has a right to good health, each and every one has a right to good mental health. And that's where we play a role, whether we are counselors or clinical psychologists or psychiatrists. We work together to provide accessibility to mental health services. And I believe that working as a team actually brings about a very holistic approach that can help many people who have mental health challenges.